Do you remember hearing about people being fully vaccinated and they were boosted, but they still got COVID? Maybe it even happened to you.
Yeah, the Omicron variant is largely to blame for that since it is able to break through the existing shots. But now there are updated boosters. They're another tool to help fight that spread. Both Pfizer and Moderna have a shot that targets all three strains, the original COVID virus and the two Omicron variants.
I like the terms the fall COVID booster. It's recommended as a booster for everybody.
Now, before you roll up your sleeve for that new booster, you might have some questions. Let's verify. Our sources are the FDA and the CDC, and a conversation with Dr. Stuart Ray of Johns Hopkins. First up, who can get an additional booster? The CDC recommends an updated shot for adults and teens. Moderna's new booster is approved for those age 18 and up, Pfizer for those 12 and up. Next, what if you never gotten COVID-19 shots before? Well, the new booster, for now, is meant to work with the initial COVID-19 vaccine series. So get those doses first.
Current authorization for these bivalent vaccines is only for boosting.
However, the new shot replaces the earlier boosters. So even if you didn't get a follow-up third or fourth shot before, then this is the booster shot for you. Next, when is a good time to get the shot? It's FDA approved if it's been at least 2 months since your most recent COVID-19 vaccine, your primary vaccine series, or an earlier booster shot. Dr. Ray says it's hard to predict if or when another surge could come, and everyone's personal timeline could look different.
I don't think any of us can be sure when our max risk is going to be. My general suggestion is if you're thinking you should get it, then you should probably get it.
What's the guidance if you've had COVID-19? The CDC recommends focusing mostly on timing of your last shot, but do say, at a minimum, defer any COVID-19 vaccination, including bivalent booster vaccination, at least until recovery from the acute illness, and you're no longer isolating. You may consider giving it 3 months' time between infection and injection.
For the reason that there's some research showing that if you don't wait 90 days, then your response to the vaccine may be somewhat blunted. You have good protection from a recent infection.
You have good protection, but natural immunity from infection is still less reliable. Getting a vaccine eventually is still recommended.